Finding the right care for an aging parent is one of the most stressful decisions a family can face. It's made worse by a dangerous myth. Nearly half of us believe Medicare will cover long-term care. The hard truth is, for most of the daily needs your parents have, it won't pay a dime. This gap between what Medicare provides and what families expect is a financial trap. In the next few minutes, we'll expose this gap, define the care seniors actually need, and show you how to find it. First, understand the sheer scale of this issue. A staggering 70% of people over 65 will need long-term support. But Medicare's rules are specific. It excludes most custodial care, the very things people need help with every single day. Assistance with bathing and dressing, generally not covered. Meal preparation and light housekeeping, not covered. And for families who need constant support for a loved one, Medicare does not cover 24-hour care at home. What Medicare does cover is called home health care. This is short-term, doctor-prescribed medical service after a hospital stay. This is strictly medical, not daily living support. So where do families turn for the help that allows a senior to stay at home? The answer is a different and far more common type of service, non-medical home care. This is the support system built for everyday life. Its entire focus is on activities of daily living, or ADLs. These are the basics of self-care, bathing, dressing, and safely moving around. It also covers instrumental activities, or IADLs, the tasks required to live independently, like meal prep and transportation to appointments. When you list what would allow your parent to stay home safely, you are almost always listing ADLs and IADLs. This is non-medical care. This is the answer to our question. The caregivers are not nurses. They are trained aides focused on safety, support, and daily assistance. And because this support is non-medical, you don't need a doctor's order to get started, making it far more accessible. But the impact is profound. It's about empowering seniors to maintain their own routines and independence in the home they love. It directly combats one of the biggest health risks for seniors, loneliness. The companionship from a caregiver is a lifeline. And for the family, this provides priceless peace of mind. It prevents caregiver burnout and ensures your loved one is truly supported. The data proves this works. Studies confirm this type of care leads to substantial improvements in a senior's ability to perform daily activities. It's not just physical. Research shows a significant improvement in mental well-being for clients, including reduced feelings of depression. So if this is the care most seniors need, the big question is, how do you pay for it? It's typically not covered by original Medicare. Payment usually comes from private funds, long-term care insurance, or VA benefits. Some Medicare Advantage plans might offer limited coverage. While this is an out-of-pocket expense, it's often far more cost-effective than a nursing home, which can deplete savings much faster. Families should also be aware of other potential costs, like home modifications or higher rates for weekend and evening care. However, good non-medical care can also save you money. By providing support after an illness, it helps reduce costly hospital readmissions. Let's connect this. Remember that 45% of people mistakenly counting on Medicare? Understanding this distinction is the key to avoiding a family crisis. The two types of care are partners, not rivals. The best solution for many seniors is using Medicare-covered home health for medical needs, while relying on non-medical home care for the daily support that makes independence and quality of life possible. One manages the illness, the other manages the life. Since 70% of seniors will need support and Medicare only covers a fraction of it, planning for non-medical care is not optional. It is the core of a successful plan. The main takeaway is this: don't wait for a medical crisis to find out what Medicare doesn't cover. Plan for the support your loved one truly needs. In Houston, families have a trusted partner for this. Encore Caregivers is a family-owned, RN-supervised agency specializing in this vital non-medical care. With over 3.5 million hours of care delivered, they understand how to create a personalized plan that works. They've also created a guide for families. Don't get caught by the Medicare myth. Download Encore Caregivers' free family guide to confidently identify the right care and make an informed plan.